Hello, my name is Karen, and you are watching Conversations with Karen. And I have a very, very, very special guest on today, Dr. Deborah Bennett. She is a physician here in Kingman, Arizona. Just a delightful person, very, very knowledgeable, a fellow in her profession. And I asked her, we were having a conversation the other day about coronavirus and COVID-19 and, why the question comes up a lot around here. Why do we have to have protective gear? Why do we have to do this? Why do we have to do that? And I asked Dr. Bennett if she would be willing to come on and share with us some of the concerns that she has as a physician and that she has also as a citizen of this community. And so, welcome, Dr. Bennett. I'm so glad you are here.
Thank you for the invitation.
You're certainly welcome. And just to get the ball rolling, how did you first hear about the potential of COVID-19 becoming a pandemic? How did that evolve in your professional?
I think that some of this became known right after the post-holidays, the end of December. I think that one of the first deaths was reported shortly after New Year's Eve. So I think so many things happen in our country over get-togethers, parties, gatherings. So some of the first illnesses that were reported were around the holidays, and no one was too surprised. But given the next 30 days, probably within 2 weeks from the time it was reported, it had moved from the Chinese market death, a fellow that had reportedly shopped at the market was dead at 61 years old. I think that grasped everyone's attentions. And then soon afterwards, Japan and South Korea, even Thailand reported those situations. So that took us from New Year's Eve, 2019, not even within 30 days, we had, I think, hundreds, maybe 200 people dying in different countries. So I think that grabbed everyone's attention. It came to the attention of many different World Health Organizations. And we were distanced just by geography, but I think most of the physicians recognize this as something like SARS, something that had the potential to be a global epidemic, which would be a pandemic, or it could be localized, and time would tell. And truthfully, within another month, I think by the 1st of February, thereabouts, we had 360 people worldwide that died. And then I think we had everyone on board. We had World Health, we had the Center for Disease Control on board. So I think it became real common knowledge. And then I think most physicians, I think before it was even reported, we knew that if we had a respiratory illness of this significance or this magnitude, our hospitals wouldn't be able to attend to all the people that reported. Although we have cities like New York and some of our megatropolises that would compare with some of the cities in Italy or Japan or even China, a lot of the United States geographically is spread out, which is a pro and a con. The pro is that you've got some distance which could minimize the spread. And then in the cities where everyone was close, you were going to have the problems of providing health care for a magnitude of people that might need respiratory support. So probably within a month or so of the new year, most physicians were on tack. They were watching the CDC reports. And most of us knew that this would be a real problem. It would be a contender with Ebola or with SARS. But it does seem that every 7 to 10 years, we have a superbug. We have a super problem that comes on board. And this was I think the highest magnitude we've seen, I know, in my lifetime. So most people were concerned about this.
As a doctor, how prepared were you personally and professionally? How were you prepared to deal with the movement of this virus through the country?
I think that most people, most physicians cringed because we really didn't have a lot of control over this virus. There was so much that was not known. And most of the viruses that we had didn't have such a quick death rate. Most often you could support people with either IV antibiotics. You could follow them with chest x-rays to see if the chest x-ray showed that there was a progressive infiltrate in your lungs. But this came on very quickly. So I think most physicians were alarmed because we all knew that there's a certain percentage of beds or respirators designated in each hospital, each area, each region. And where we're located, we're in Kingman, Arizona, but we're in Mojave County. There are 3 hospitals separated by miles, 45, 50 miles. So they're not, our cities are not contiguous, which protected us, but our hospitals were distant so that it made sharing necessities like respirators a little bit more difficult. And we are set up to provide care that we anticipate. This was not anticipated. So we were prepared as you can be for any usual occurrence. We were not prepared for a world pandemic, as I think most cities weren't. And because we hadn't had an epidemic of this magnitude in the recent decade, I think people become complacent and think, well, everything must be fine because we haven't had anything. And so some precautions and preventative drills were dropped. And so it was a dual-edged sword. We had a episode of infection that was a magnitude that wasn't prepared for, and then we knew we'd have limited resources. And then for myself, I knew that we'd have some limitations in our personal protective equipment and the respirators. I have to say that our small community in our region prepared very well, and then we just had to sit and wait. And I think we were, because we're distanced from the northern cities, we're just experiencing our surge now. So the story is yet to be told in this area.
Yes, I think our numbers in Mojave County have quadrupled just in like a week and a half. You know, it's just phenomenal, the amount. Is that due to more testing, or how are those numbers, you know, ascertained?
The numbers come from CDC guidelines and mandates, but what we have to remember is that we are under stay-at-home orders. So a lot of people are self-quarantined and they are at home suffering. So some of those numbers aren't collected until perhaps the patient gets worse. We've had patients in the region that have died at home from it because they chose not to go to the hospital. But the numbers are telling us that we're not on a decline. The government has given us the opportunity or the challenge to stay at home, help flatten the curve. And a flattened curve is just a bell-shaped curve where you would hope that the potential to rise can be dampened down so that you don't reach a real peak and so that you don't continue to spread infection. And in our communities, for the most part, wearing masks, people have been doing that, they're staying home. I think that all of us have seen on the roads, there have been times when I've been traveling the road where I don't see a car for another minute or two. And I think, yes, people are getting it.
Well,
the word is spreading.
Yeah.
Yep, you know that it's effective. You might see someone in a store or something that doesn't have a mask. You might politely educate them. And I think that for some of us, we just need to understand that it's not, in our region, it's not the cowboy mentality. I'm tough and I can take it and I would make it through anything. It's that you have the ability to transmit to someone else when you're not feeling ill. Right. So what we're doing is we are being preventative, we are being proactive so that we don't give it to anyone else along the line. And what I've explained to my patients is that by staying home, by wearing a mask, by washing your hands several times a day, especially when you come back from being out, you are effectively reducing the number of people that are affected by spread. And then we have bronchitis and a sinusitis and pneumonias that go around anyways. So that compounds this picture, because the picture looks like everybody's got respiratory symptoms. So everybody must have COVID. Well, no, most of our testing is negative, and we have tested the appropriate people. But we take our preventative measures to protect the entire community. And I think if our community members, of the people in our region and our state, realize that, I think we'll be effective. In our area, the Navajo Nation is really suffering, but they have, as a regular culture, living in tight quarters, not having access to freely running water everywhere, the things that we take for granted. So we should really, we need to rise to the occasion, be good stewards of our health in our community, and we need to wash our hands, stay home as much as you can. If you've got elderly neighbors, maybe send over a message that I'm going to the store. Can I pick anything up for you? Keeping our susceptible people out of harm's way does an awful lot. And if we can promote the idea that we are in this together, we will do so much better.
I've seen that a lot in this community of people reaching out that way. I just love it. On Facebook, I've seen many times people saying, you know, if anybody's going out, I need this, this, and this, and there'll be 20 responses say, I'm on my way, you know. So it's happening. Now, talking about travel, I mean, we drove to Flagstaff the other day, and it was amazing. I think we passed maybe 10 cars, you know, in 50 miles. But you come and go every day to your job and back. And I know we've had this conversation before, but I just want you to share with us, what is the routine for you when you come home? What does that look like?
I have a routine.
How long does it take?
Well, you know, it's getting, I'm getting more efficient with my time, because you have to picture that everything that I've touched, every person that I've touched, carries with them their own germs per se. Mm-hmm. So it starts out in the beginning of the day when I get into work. I don gloves. I clean with an antiseptic my whole work area, my computer, my monitor, and then the ladies and I that I work with get ready for the day. We put on face masks or shields. We put on masks. We wash our hands, get ready for our patients, and everything that we touch has already been cleansed with a Clorox type cleaning solution. Now, I'm not a proponent of Clorox per se, but it's something that has to be antiviral. If you look at your boxes and your pop-up wipes, a lot of them will say antibacterial, and fewer will say antibacterial and antiviral. If you have the opportunity, we'll buy the one that says both.
That's a good
So we
point.
will clean everything down. When our patients come in, they're explained that Dr. Bennett would like you to wash your hands and put on a mask. So they wash their hands, and in the meantime, we're telling them how they're protecting their community and they're protecting me. So as we do that, it's really very unique, because people will say, I'm ready for you. I'm prepared. They got their mask on, and sometimes it's on right. We've got to remember those masks need to go over your nose. They're not to protect your mouth. And they're certainly not to be worn under your chin. Although it might help if we did that, but it's not under your chin. It should be under your nose, so it prevents any respiratory spread. So our patients have them on. I have them on. I get very close to people. I have to look in their ears and their throat. I look for sore throats, which is one of the signs that you might have this virus. But then when I come home, you have to take everything off. So I get into the back door, and my clothes come off. They go right into the laundry with some disinfectant and some detergent. And then I wash from my hands to my elbows, or I just take a shower. So I'm probably one of the cleanest people in that office. But I honestly take a look at how many people are breathing on me through the day. Right. And a little later in our talk, I want to go over my list of how long these viruses can last on clothing or other surfaces. So I'm not giving it a chance. So I've chosen fabrics or clothes that I know will withstand daily laundering and hot water. But I think everyone that works in the community or goes out into the community should have that same philosophy. You know, you lean over on something, you touch something, someone walks behind you and bumps you. Whatever they had on them is now on you. So by the time you get home, you've probably been touched or contacted by a few people, and you've got all of the dangers that they have. So you just have to be cautious and then make your home your respite.
Mm-hmm.
I go along, and I think everybody should take your disinfectant wipes, get all your doorknobs. That's something that a virus, because they're metal, can last 2 or 3 days on. So somebody comes in the door, touches your doorknob, you've got coronavirus on your doorknob, and your kids touch it, you touch it, or on your light switches. So get your doorknobs, your light switches. Where else does everybody hang out these days? In the kitchen. Get the handles on the fridge. Everybody stands there. And if you tell me that nobody in your family does, I don't think you see it happening, because everybody's does.
I have another question around that. You have 3 of the most lovely little Bijans I think I've ever seen in my life. Are you worried at all about them transmitting that to you?
Truthfully, I'm not.
Because I know that that's a question that people have asked.
That question has come up with animal lovers, with horses, with dogs. And at this point, it's not significant. There has been a few cases where they think that's where they transmit it. But honestly, the story has not been written. Until we can test the antibodies, we really won't know who's had it. And I think the picture may change. It may change our way of thinking, but that will be a more accurate tracking method once we check antibodies. But for this point, no, I'm not worried about that dogs. They're more worried about lizards.
I have a question about what's the difference between checking for antibodies and checking for contagion? You know, testing positive.
The contagion is you're actually looking for the virus particles on a surface.
Uh-huh.
So the virus particles are live, they're on the surface, and you're checking for the presence. Are they there or not? And this is why it takes a couple days sometimes to find out, because you have to grow them. You swab the nasopharynx or inside the nose and the throat, and you get a sample of where it's most likely to be. And then you have to wait for it to process, but you're checking for that virus. Yeah. Now, the antibodies are quite different. The antibodies are the body's immune system, your fighter portion. Your immune system attacks a foreigner, and this COVID-19 would be a foreigner. And then it says, I'm not going to let you live in my body. I'm going to make antibodies. So if you come back around again, I'm going to kill, kill, kill. And in some texts, they're called killer cells, cytokine killer cells. So once you've been exposed to it, if your immune system is active and you've given it enough time, your body will make a substance, an antibody, to fight that again. So the thought is that if this comes around, if it's a cyclic virus and it comes back in the fall or winter months, how many of us will be able to fight that because we've been exposed? And we have to remember that not everybody exposed has symptoms. Not everybody that has symptoms are severe. And the people that are severe are in the hospital. Not everyone dies. We're still going with the percentage of 97% people heal and get better. They might have a very rough road, but 3% don't. And that's about double, triple, sometimes 10% higher than the regular flu. So this is a super virus that's infecting our system, but our system has the mechanism to fight back once you've been exposed. And there's 3 different companies manufacturing the antibodies. And that will tell more of a study for us. And I think if we're going to have to wait until August, probably July or August, to get some of those figures back. And they're going to be starting with some of the healthcare providers, thinking that we've all been exposed. Did some of us have it and it wasn't severe? And I'm eager to see what those numbers are. But Karen, you're right. There's a complete difference between testing for what's there right now than how your body responds to fight it. And then hopefully we'll have some predictability for the fall and winter months. You know, how many people we expect that will fight it and fight it well.
Right. So if I've had coronavirus and I heal from that, or if I've carried it and didn't know it, and it went, you know, in my body, it did what it needed to do, can I catch it again? Say
Yes.
when that next wave comes, can I catch it
Your
again?
body would fight it. You would probably, it's like most of our vaccines, your body would fight it.
Uh-huh.
And in a good preponderance of the cases, you would not get it. And there's a part of it where maybe your immune system didn't make a full antibody or full immune response to that, and you might get a much milder case. That's why we tell people with the shingles vaccine or the pneumonia vaccines, take it. They'll say, well, I've already had pneumonia for this year, or I've already had this or that. Take it anyways, because if you have a vaccine, it means that your body will have more of an ability to fight it. It will be prepared for what comes. Might not be 100%, but it's a lot better than not having it.
Yeah. Can you go through what happens when somebody's in the hospital? No, we just had a friend of ours who was in the hospital with coronavirus, and she was doing great, and they were going to discharge her, but all of a sudden she crashed and ended up in a coma on a ventilator. Can you describe, because that's not an uncommon occurrence, can you describe the process of that virus and how, you know, how can somebody end up, you know, on a ventilator when just 5 hours before they were going home?
When we listen real closely to our patients, I spoke with someone just yesterday and the day before, and their scenario, and they were much younger, probably 30 years younger than the person that you know. It seems that they have the fever, chills, cough, cold start to get better.
Yeah.
And even at that time, we can take a chest x-ray and we can see changes that occur. One of the terms that's being used is ground glass. And it's almost as if you look through a frosted glass, you see the same change in people's lungs. So either people develop that ground glass or frosted glass appearance. Now that means that all of their lungs are affected. So an older person, let's say that had smoked or had diabetes or hypertension, they're at higher risk, where your body would say, okay, I fought the good fight, I can't take it anymore. And your lungs seem to be the area that take the worst hit. Then the ventilator gets you through a few days. If the few days on a ventilator can give your lungs a reprieve and your body a rest, then they'll come back full force and you're able to fight it. But there are those people that maybe they had chemotherapy, maybe they fought cancer once or twice and had these other conditions. And then their lungs just get filled with what we see, this ground glass appearance, and it just progresses. So, but we've also seen, you know, the 31, the 48-year-old people that have had it. Some saying it was mild and some saying it was absolutely terrible. So most of the people, though, that progress to a ventilator, and then let's say if they pass away, I'm not going to say it was their time, but they had complex medical conditions, and they were the people that you'd say you probably couldn't take one more severe infection because your body is stressed. You don't have the immune support. You're not strong enough to take this. And I tell probably, I don't know, 6 or 7 people a week, just that scenario. Stay in, stay put. Don't drive up to the McDonald's and go in. Thank goodness they're closed. But some people have lived with these conditions for so long, they don't realize that they are the people at risk. And we are really staying home to protect the entire community.
So what you say, you look at an x-ray and it looks like ground glass. What's going on in the lungs for that appearance to show on an x-ray? What's happening when that virus gets that
virus
far down?
That virus is acting like a pneumonia and settling in the tissue of the lungs, and it's a little bit harder to clear. Now, most of the people in the United States that get a pneumonia have had 1, 2, or 3 pneumonia vaccines, if not more. So our lungs, our systems, because of the vaccines, are used to fighting the common, like community-acquired pneumonia, mycoplasma pneumonia, the pneumonias that are common, So you're exposed to it in the community. Your doctors or your primary health care should be advocating that you take your pneumonia vaccine, and most people will. There's the Prevnar, there's the pneumonia 13 and 23, and most people have had them once or twice. So we're protected against that. But this new stranger invader comes in, and our lungs aren't prepared for that.
Okay.
So
Yeah.
it acts like a pneumonia that has the opportunity to go wild. And we have to remember this is a virus, not a bacterial type of pneumonia. So we can't hit it with 2 antibiotics and think it's going to get better. We have to wait it out. And that's where the problem comes, that if you're weak to start with, you're not going to be a good patient that's going to be able to tolerate 2 or 3 days of struggling.
Right. Now, a lot of times we hear talk about a ventilator, and, you know, my concept is I had no idea the complexity of that piece of machinery and how it is so invasive. I know you were sharing this the other day. Can you just kind of walk through, from a doctor's perspective, walk through what putting a ventilator into our bodies is like? What do you do, and how does it help? And what does it do, actually?
You hit on one word, complexity. We don't stop to think that our lungs have a function, and that function is taking in oxygen, blowing off carbon dioxide, and then it affects something called your blood gases, your pH in your body. So if you don't blow off enough carbon dioxide, if you don't take in enough oxygen, your internal organs will fail. So there comes a point where people aren't what we call moving enough air. If they aren't breathing well enough on their own, we have to determine whether or not a mechanical form can help. And I always advise patients, this is, in my estimate, in most cases, it shouldn't be a life-altering decision. Don't withhold a ventilation assist from someone who might just need that help for 2 or 3 days. We need that help. It will force air into your lungs. It will help remove carbon dioxide from your system, so it keeps those balances I just spoke of intact. And without that, your body would go into a pH, an acid-base state that wouldn't be tolerable with life. So you need that. And very often people will go on it for 3 or 4 days and then come off. I don't know if people will recall, but last month we had a pregnant lady that started to have a lot of respiratory distress, was diagnosed with COVID, was on the vent for, I don't know if it was 15 or 20 days. She came out of it, had the baby, and all was well, because the ventilator kept her lungs functioning as if the COVID wasn't there. So it kept everything going. And it's not going to be the case for everyone. We will lose some people that go on a ventilator, but in most cases, there's an underlying condition. So I think that people shouldn't be fearful of them, but be knowledgeable that we're wearing our masks, we're cleaning our hands, so that the hospitals have enough ventilators so that we don't increase the need where we don't have a supply. And I think if everybody just keeps it in mind that, you know, even by staying home or wearing a mask, you're helping those people that need to go onto a ventilator. You're protecting the doctors and nurses that work with them. You're protecting people like me that see you in outpatient clinics and make sure everything is going smoothly or diagnosing a problem early. So I'm going to go right back to that phrase, you know, together we'll get through this, but it's going to take everybody's help.
Now, when this first started spreading, the symptoms were pretty few and pretty designated, but it seems like the more you learn about the virus, the more symptoms seem to be cropping up for people. Can you kind of run through what are the symptoms that your profession is finding that, you know, is attributed to coronavirus?
The classic 3 or 4 are really fever, chills, shortness of breath, and they're adding repeatedly shaking. And that seems to be more significant. And they've expanded those 3 or 4 to coughing, extreme fatigue, and acute respiratory symptoms. Now we're seeing more sore throats with this. So
why is the shaking part of that? I mean,
The shaking sometimes has to do with an increase in temperature. So as your temperature goes, either goes up or goes down, your body is recognizing that there's a foreign object causing a fever, and we call it a fever of unknown origin. You've got a fever, we don't know what it's from right now, and that's what causes it. And most adults don't have that. I say hadn't had that in the past. So this, a lot of people that are coming in and saying, I've never shook like this before. I've never had the fever or chills that went on to feel like shakes. So most people will say, I've never had anything like this before.
Wow. Yeah. Are there any other symptoms besides that?
Well, since it does present with flu-like symptoms, sometimes muscle aches or pains. A lot of times people will say it's like the worst arthritis you've ever had, but our regular influenza A and B will do that. So that's why we've had patients that have been concerned because they went in and thinking they might have had coronavirus, but when we tested them, they had influenza A or influenza B. And then most often, if you've got that, you don't need the test for corona. But if influenza A is negative and influenza B is negative, that makes you think, oh, okay, what else is left? Let's check for corona. And if you've got the fever, chills, especially the respiratory, remember I talked about the ground glass appearance. Most people wait 2 or 3 days thinking they'll get better by the morning. And then when we get a chest x-ray or repeat a chest x-ray, we can see that there's infiltrates that are classic for the coronavirus.
Yeah, and that virus replicates very quickly, doesn't it?
Very quickly. That's why people seem to be getting sick quickly.
Yeah. How is that spread? Now, you've mentioned contact with hands and putting hands on. I sit like this a lot.
Yeah. Well, you and almost everybody I see in the office, and if you stop to think, the other day I was trying to count how many times I touched my face in an hour, and I was amazed. I just did it. I was amazed. But it is spread by respiratory droplet. It's aerosolized, so it's kind of a real fine spray. But this is what I want to remind, and if it's okay, so I want to kind of go through this right now, that countertops, where we're working every day, you come in, put your purse down, this or that, it can live on countertops for a couple hours, up to 3 or 4 days. So if you don't go and wipe that down during the days and the kids come by and touch this, mommy, I want this, I want that. Metals or silverware up to 5 days. So if you put down a spoon or a fork and you don't, and somebody else comes by and picks it up, hey, they didn't look to see if it was clean or not. It looked clean to the kids.
And that's car handles too.
Car handles, the steering wheels, but on wood and furniture, wood type furniture, 4 days. Plastic, like our milk containers, detergent bottles, seats, backpacks, 2 or 3 days. So if you grab a backpack on your way out, before you come back in the back door, you should be wiping it down with a disinfectant wipe and then washing your hands. So stainless steel, like refrigerators, are 2 to 3 days. Get this, aluminum cans, like soda cans, 2 to 8 hours. So if you set yours down and it's got coronavirus on it, hubby walks by, takes a swig, that tasted good. He just got coronavirus all over him. Paper, some papers, it will live for up to 5 days.
Wow.
Excuse me, I got a cough. Let's see, food. Food doesn't usually transmit it. The CDC is recommending that we rinse off fruits or vegetables, but I think it's really important to wash your hands after coming back from the grocery store, because if we touch things and put them back or look at them.
Right. I like the way you coughed into your elbow there. That's yeah, that's good. Now, I know I've heard a lot of people say that they're really nervous about coming back from the grocery store because they don't know who's handled the lettuce and who's handled the canned fruit or whatever. Is there a reason to be worried about that, or is that just kind of You know, by the
Well,
time
sure
it
there
gets
is,
to the
because
shore,
you're bringing something foreign into your house. And we just
mm-hmm,
talked about how long this lasts, and we all bring home a number of these items from the store. I
mm-hmm,
spoke with someone from Michigan, and they had a real burst. They were number 4 as far as severity in our states. And they suggested coming home, taking your food out of your bags and then wiping them down and then bringing them into the house and disposing of the bags.
mm-hmm.
I've got to get a glass of water. I'll be right
Okay.
back.
Well, while she's doing that, I'll just do a little commercial here. This is a project that I started back in March, and of just having conversations with different people. And I'm loving doing this, and it's just it's fun for me, and it's informative to me. I'm learning while we're doing this, and the people who listen to this are learning also. If you want to help this program, if you want to help keep it going, check out shamanzoom.com and send $5 donation. And anyway, Dr. Bennett is back.
Yes.
We've never had a commercial break before. This is great. Okay. So I know there's a lot of controversy about, wearing masks, gloves. I want to be able to do what I want to do. Gloves are not useful. Masks don't mean a thing if they don't have filter, all that stuff. Can you articulate from a physician's point of view, why is it important for protective gear?
Because this is a respiratory infection and it's spread by respiratory mechanisms, and we've been able to show that it can spread from 10 to 20 feet. The person behind you, across from you, could sneeze, could cough, and it's even spread by talking. So if the people in front of you are not utilizing social distancing, a husband and wife maybe think they don't need to, and they're chit-chatting and laughing, that is spraying all over the 10 feet around them. So, look at little Linus from our little cartoons. He's the one that's got all the dust and all the dirt around him. That's the coronavirus. It's all around us when you're talking, coughing, laughing, and it lands on the surfaces. So anything you can do to protect yourself. Do you have to wear gloves all the time? Well, no, but if you're going to be going to the grocery store and you've got a pair, use them, and the mask. Realizing that one of the falsehoods is that you're completely 100% protected because you have gloves on. That's not 100% true. People sometimes have gloves on and think they can just go without caution. You still have to be cautious. And remember, when you take your gloves off, you take them off from the part by your wrist so that the part by your fingers is pulled through. So that in essence, you're not touching the front of that. You do the other side. Same thing with your mask. The front of your mask, consider it full of nasty particles that are infected. You don't want to take it off like this. You want to take it off by your ear loops, release it to one hand, carry it over to either be disposed of or to wash. Do not take it off like this. Do not play with it and adjust it, because you're just getting the worst viruses on your hands now. And then women go and touch their face. So we just need to realize, once you put the mask on, you leave it alone. And then I think we'll be fine.
And if you're positive too, touching the inside of the mask when you take it off can be just as,
right.
Yeah, that makes a lot of sense. That makes a lot of sense. Is there any, I know the N95 or N99 masks are preferable for health, frontline people. Are the cloth masks that we're seeing coming out, I know when I scroll through Facebook, every other ad is for somebody making these little masks. Are they just as effective, or are they adequate for
the CDC has gone back and forth, but anything that traps bacteria and possibly viruses is of significance. If you could have a mask that had a filter in it, some of the HEPA filters are enough to create an added barrier. But the masks that we wear that are made of cloth will help. It'll help you from spreading bacteria to other people. It may not help you from picking up all the viruses that are out there, but the masks are really also intended to keep you from touching your face. So if you were to touch countertops, go shopping, touch the cart, you've got all this on your hands, and when you've got a mask on, you're less likely to touch your face. Mm-hmm. So it prevents the transmission by a couple of different methods, but I think that a mask may be the new norm. Mm-hmm. And I think that it's best to realize that our healthcare workers and our frontline workers, they really do need the N95s. The N95 isn't necessarily 100% recommended for people shopping. I mean, if everybody went out to the grocery store and took one of those, your midnight nurse might not have one.
Right.
So we need to kind of prioritize, and in doing so, the cloth mask would be fine. If they had a filter, they'd be better. But again, the key is don't touch the front of the mask. When you take it off in proper methods, and do it every time. Do it every time you go out.
I'm wondering if some sociologist somewhere will do a study on, I wear glasses and I'm always doing this, or adjusting them or whatever it happens to be. I wonder if there is a correlation of more people touching their faces that have glasses versus people that don't. That I know there may not be.
I've not heard of any studies, but I bet you there will be some. Because I think that there's a sense of isolationism too. I mean, we wear protective goggles or a shield all day, and I can't tell you how many times we see each other going like that, and oh, the shield's there. So you're made aware of how many times you touch your face.
Yeah.
But again, it's the new norm.
Yeah. What are some recommendations you'd like to share with folks who don't have a medical background, and just are, trying to do what they need to do to stay safe and to keep other people safe? What are some recommendations you might have?
I think to begin with, just realizing that the education that either comes from the CDC or from the World Health Organization, which are our two standard educational bodies and research bodies, are truthful. You can read anything on what we call Dr. Google. You can go and find whatever you want if you look hard enough. So just realizing that we have these super bugs that come around every 7 to 10 or 11 years. And some of them reach America, some of them don't. When they reach the whole world, if they're global, they're a world pandemic, and pan just means worldwide spread. So it's a worldwide spread. Everybody needs to be doing something. This one is respiratory. Protect your airways. You can take in something dangerous by your airways. You can blow out something dangerous to other people around you through your airways. Cover them up. Yeah. Protect yourself, protect others, and wash your hands. There is no substitute for washing your hands. A close second is using a sanitizer if you don't have water. There are areas, even here in Arizona, where running water is not common. In those places, we really need to get the sanitizers out, or we need to get people there that will improve these living situations so they can have water. But everyone in this country should be protecting their respiratory status, protecting everybody around you, and that means a mask of some sort, washing your hands. And if you really want to create an environment that's pretty safe in your home, you develop a regimen where you go around and it's a designated person and you wash, now not soap and water to electric outlets, but your hand sanitizer cloth that you can tear off should hit your light switches, where the kids do their teeth brushing, where your faucets are, your toilet handles. Think of how many people have touched that toilet handle and maybe where they've been. So go around your house and pretend you're a kid or a child and make sure you clean everything at that level. And then by all means, the kitchen. get that refrigerator, the back door handles, and even the countertops where the kids might touch. It takes you probably less than 5 minutes, but you will have an odor that indicates you've really disinfected pretty well. And remember that with disinfection, it's the contact time. How much time is that disinfectant chemical in contact with the door handle? Let's say you go and clean it. Don't take a paper towel and wipe it dry right away. Let it air dry. It needs to be on there several minutes to be effective. And same thing goes with your light switches. So do not go and wipe it back off with a dry cloth. Let your sanitizer make contact for at least 4 or 5 minutes. Take a look at the sanitizer and see what the minute is. I know in the hospital situations, we have that built into protocols. Take a look at what's on the sanitizer bottle, and whatever the time frame for the minutes are, that has to make contact with that surface. It's not magic. You just can't touch it and the little bad virus is gone. It needs to make contact to kill the virus that's there.
Right. Have you made hand sanitizer? I know a lot of people are making their own. Have you made it?
I have made it.
You have.
I have ordered alcohol. Now they didn't all come together. They came weeks and months apart.
Right.
But I have a little chemistry set up on my dryer,
Yeah.
and I am making hand sanitizer. You can look for the recipe, but remember, we like to see 65 to 75% alcohol content. So it's usually 1/4 cup of your favorite aloe product and 3/4 cup of alcohol, and then you can put fragrance in there, like lavender, 10 drops of your favorite fragrance, not perfume. Just something to make, but remember, when you pour this out onto your hands, it only takes a drop or two. And when you do wash your hands with a sanitizer or with water, you need to get the palms, and then you need to consider the opposite side of your hand. We call the dorsum, but the opposite side of your hand, take your fingers and rub them over your other fingers and get the spaces between your fingers, because that's where most people miss. You got it right there. So make sure you've got like 10 on the palms and 10 on the back sides, and then another 10 just because you're happy, and then you're done. But the sanitizer needs the same process.
Yeah. Is there anything that you wanted to answer that I haven't asked yet?
Are you talking to me or our group watching?
No, you. I'm talking
to
you.
In our area, and I think a lot of hospitals are doing this, we have, what are they calling it? We have KRMC Care Anywhere. And by dialing the number, you will come in contact with a professionally trained healthcare provider, a nurse practitioner or doctor. They will review your symptoms with you. Now, you might be at home thinking, is this something or is it not? Or how high is high for your fever? Should I go in or not? Most hospitals have set up like a doctor helpline. You can give them a call, and most hospitals, I can't speak for everyone, but ours is doing it free. The idea is to keep you home if it doesn't sound significant, but to get you in for a swab or a testing if it does sound like you've got the symptoms. I would say that people should be taking advantage of that service if your hospital provides it. And if you don't know if somebody does, call your hospital. There'll be someone that's assigned to take these COVID-19 questions.
So if somebody, say I feel like I'm infected and I'm experiencing some of the wide variety of symptoms that you've articulated and that, you know, I've read out there and my neighbor has said, whatever it happens to be. If I'm feeling like I may have the virus, what's the first thing I need to do, and what's the steps that I need to take, just in general?
I think the first step is to realize there is help there, even though we're at home quarantined, because most people feel a little isolated. And then they think, well, maybe this is in my head. Maybe I'll wait till tomorrow. Don't wait till tomorrow. Pick up the phone, call your hospital and say, is there someone there to speak with that can help me review these symptoms with me? I think I might have this. And they should direct you. I think most hospitals have a patient quick answer line where you can just pose your questions get some professional advice, and then get directions on what to do. You know, will my Medicare cover this? Will my insurance cover this? You know, people have questions that keep them from getting health care that you might not think of. And at a time like this, people think, well, I don't, you know, I already have an ambulance bill and I already owe for this. I don't think I'm going to go. And when they find out that this service is free to the community, I think that it puts them in a much better state and the community, because then we can easily identify quickly and early on and begin treatment. And sometimes it's just stay at home, but it just gives people relief too. But the thing to remember is don't do nothing. If you think you have something, pick up the phone and call one of your local hospitals, even if they're a distance away. The advice is free. It's over the phone, and you'll feel that you're actually catching something quickly. And that's what we want to do, identify and then treat. And a lot of times the treatment is just staying at home, but we are really trying to identify by testing. In the end, it's going to be data, data, data. Everybody's going to take a look at how many tests, how many positive, how many deaths. And we want to make sure that we have a lot of people tested if they've got the symptoms, so that we know that we adequately screened. And then we'll know how many people might be positive for antibodies and able to resist it.
I heard a comment yesterday, and the person I was talking with was saying, well, you know, I could go get tested today and come out negative, and then go to Walmart tomorrow and end up positive. So what good is the test in the first place? To me, that was an interesting question, and I really did not have an answer to.
Well, it's real simple. That, like we described the difference between an antibody and testing for the test, it's what is there at the time. And we know that you can have it and not show symptoms for 10 days. So let's say on day 2, you have 2 sniffles, you sneeze twice. You shouldn't be going because whatever, but you go and you get tested and it's negative. But then over the week, it gets worse and worse. And now there's a cough. Your symptoms have changed. So your risk has probably changed. You should be checked again. That's why we're telling people don't come in if it's something insignificant. That's why we have screeners to help you decide whether or not it's important and if you have high risk. And then they send you in to be tested. And I think that's a prudent method of distributing these tests. It's a prioritization. Who's got the high priority? The people that have got the cough, the fever, chills, and shakes, or the person that says I sneezed twice? You know, and it can change. You can have a negative test one day and 2 weeks later be positive. Look at all the contact you had in between. So if you've been tested once, it was only accurate for that time. That's kind of what we call a snapshot. In that snapshot, in that moment in time, you were negative. But you could be positive 3 days later because that's when the virus really grew enough to be identified.
Boy, that makes sense. Because then backtracking just for 2 weeks is a heck of a lot better than backtracking for a month or so.
Right.
You know, that makes so much sense. Dr. Bennett, is there anything else you would like to share with us?
Success is measured by the number of people who really participate. And I want to make sure that everyone knows that they have an important part to play in the successfully getting through these times. And I think that the cities that are going to fare better than others are going to be the ones that use their equipment appropriately, use their testing mechanisms appropriately, and reach out to the community. So help your neighbors, stick with the process. It's very difficult. We're going on, 2 months. People are getting stir crazy at home. So we just stick with it and know that you're doing the right thing, and good times are ahead, but we just have to stay put for the current time.
I just want to, I am so grateful to your profession. And I know, I feel emotional about that. I just know the work you're doing. And I, we're neighbors practically, and you're part of our faith community. How do you support one another? How do your docs and nurses and frontline CNAs and how do y'all support one another in this incredibly trying time?
Everyone's going through the same thing. And Karen, the cities that have been hit really hard, New York, Texas cities, Michigan, I really applaud some of these doctors and nurses. And I don't know if the people listening understand, but some of these nurses have taken their children to the grandparents so they can stay day and night in the hospital. So that, number one, so their kids don't get exposed, but because it's their life passion to help protect and take care of people.
Mm-hmm.
And it's probably the same for our firefighters, our EMTs, and right down to our grocery workers. But when we celebrate the next couple weeks, some of our healthcare heroes, as the television media are calling them, please realize that some of these people have really sacrificed, not only going in until a dangerous situation, but they have rearranged their family structure so that they can care for the rest of us. It might not be you in particular, it might be your mother, your father, or grandfather. We all know someone now that has had this, maybe had a tough time, like the lady that you described, Karen, on the ventilator, and she's off it and doing better. We need to realize that there have been people that have sacrificed a lot in our profession and in other professions. But for these young people that have restructured their family life and shipped their kids off so that they can do the work they do best. And I think that it's a God-given talent that they continue in these times, because it would be just as easy to say, I'm going to stay home and I'm going to take care of my family. And these are the brave people that are saying, Mom and Dad, you take care of the kids and I'm going out there. It's almost like the firemen that we all remember rushing into the buildings in 911. The brave people that are going in knowing that there's danger. Yeah. And certainly our health heroes are doing that.
In communities that have had a real upsurge, I mean, we're just beginning our surge here. But in communities that have had a tremendous upsurge, where these healthcare practitioners have had to really isolate themselves in the hospitals, those kinds of things. If that were to happen in Mojave County and Kingman, what can we do to help support them? Have y'all thought about that at all?
I think that we've done some of that. We've asked for donations for personal protective equipment, and from carpenters to millwrights to cabinetry makers, N95 surfaced from all over. Help your hospitals if they're looking for those donations, and they always are. I think that our masks, we've got 2 or 3 companies now in the nation. They're not coming from China, but in the nation, that are putting out PPE equipment. So that should be better as time goes on. And just following through with that portion, if the community has a need. But remember that by staying home, you are just contributing just as much, maybe not, you might not see it that way, but you are protecting our healthcare workers because you're not putting us in harm's way. So by you staying home and wearing your mask when you have to go out, and maybe if you have a friend or so and they need to be educated how important it is, relate to them that we need you. We need our community to support us so we don't get ill when we go in, because then the downside of that is going to be we'll have less healthcare providers when they're needed.
Yeah, exactly. And I was watching one of the news broadcasts this past week, and she did a rundown of how many healthcare providers have been infected and how many have died in this country so far. And it's in the hundreds. I mean, hundreds. And thousands as far as being infected.
And it's not the predictable ones. So it's not as if you can say, well, these group need extra this or that, or this group can only be on shift for 6 hours because they're high risk. It's the ones you don't expect. So if we could predict it, it would be wonderful, but we can't right now.
Yeah, that'll be in hindsight. After this is all said and done.
That'll be in the data-driven aspect.
All the data that comes in, absolutely, absolutely. if anybody has any questions, turn your mic and your video on if you'd like, and Dr. Bennett is here to answer that. And if not, that's okay. It is, we've been in this an hour, and I know that you're busy. I so appreciate you're taking the time to be here and to help understand, you know, bringing a physician's perspective into a layperson's, you know, understanding. I so appreciate that, and I value you as a practitioner and as a personal friend. I think what you're doing is remarkable. I wanted a picture of you all geared up, you know. But
I will get you one and you can use it.
Yeah.
Thank you for the opportunity, Karen. I think that
Dr.
the
Bennett,
opportunity to spread this information is invaluable.
thank you so much, Dr. Bennett, and thank you, folks, for watching. May you feel the blessings today and stay safe. Wear your mask, wash your hands, do your doorknob, whatever it takes. Otherwise, Dr. Bennett will be on you. Thank you. Y'all have a very nice day, and just keep everybody in prayers because we are in a really tough time right now. Blessings and have a wonderful day. Bye-bye. Stay safe.